From Dr. Tiffany Sizemore says that Obamacare has had a negative impact on her patients, and the good doctor is a cardiologist, so she's a real schmatty pants besides. So, doctor, what are you seeing up front?
It's been a little bit of a problem in my practice, honestly, really because of what the gentleman was saying. People's deductibles and their out-of-pocket costs are through the roof. And the problem is most private practitioners like myself, we collect this money up front. We don't send them bills. So when we tell someone that their, annual physical or, their follow-up visit is going to be over $100, they look at you like you're crazy because I have insurance. Why am I having to pay so much? That's one problem.
But is that an Obamacare phenomenon, or did you have this prior?
No, the deductible in my practice, at least, has been an Obamacare issue. The deductibles of $5,000, $10,000 were just not there a few years ago. Now, some plans, of course, they were, but as a whole, if we're looking at insurance as a whole, the deductibles have ballooned big time.
Go ahead.
The second problem really is this, the biggest lie of 2013. Now, you can keep your health insurance and you can keep your doctor, but I couldn't keep my patients. It's like a bad rerun of Jerry Maguire. Where are my patients? My patients have disappeared from me because they can't either afford their plan or I can't get on their plan as a practitioner of whatever insurance plan they have.
Now, obviously, things get very expensive when someone has a cardio-related issue, and then with those high deductibles, all bets are off, right?
Of course, yeah. I mean, when someone comes to see me and they're having chest pain, odds are they're going to need an echocardiogram, a stress test at a minimum, and the office visit. I mean, the out-of-pocket through an insurance, if I bill that and they have a deductible, you're looking at close to probably $600. And a lot of times patients say, well, I don't even want to go through my insurance. I just want to pay you cash. Will it be cheaper? And honestly, a lot of times it is cheaper if they don't go through their insurance.
And a lot of them will risk not getting that checkup or that cardiogram or what have you because of the cost involved and endanger their lives, right?
And that's true, and it is their right. It's their right to say, well, I can't afford that or I don't want that. And then it's my responsibility as a practitioner to try to, nudge them in the right direction. And at a lot of times I've just done it and not charged them because I really know it's something that they need. And that's then affected my practice because I have to pay the technician who's doing the study.
Do they go outside your practice to get those, or do you have a lot of these, like either MRIs or scans or electrocardiogram machines available to your office, or they have to go out of your office to get it?
I do a lot in my office. I do plain stress tests and echoes in my office. But when we're talking about someone, for instance, who needs a nuclear stress test, first of all, I have to jump through 25 hoops of fire and a leotard to try and get them approved by these insurances. And then once they are approved and they have to go towards a deductible, you're looking at upwards of $1,200 for a nuclear stress test. It's unbelievable.
Wow, that is bizarre. Doctor, thank you very, very much. We'll watch what happens. I'd love to have you back. Dr. Tiffany Sizemore, that's the reality, folks, here, because a lot of the times the things that you would need to check up and see if you need something more severe, if it's expensive, you're just not going to do it. And in extreme cases, you're going to die. A little more after this.